My name is Marcy Rosenbaum. I'm the Behavioral Health Director at Saltville Medical Center for Southwest Virginia Community Health Systems. And I'm a licensed clinical social worker and a certified substance abuse counselor.
Can you give us an in-depth example or experience of a college student, aged individual with a substance abuse problem?
Sure. One that I can think of right off, there was a fella who came to see me because his family had encouraged him to come. And he had started out with some alcohol use in high school and some marijuana use. And as he became 18 or 19, started abusing pain pills. And his abuse came to the point to where it interfered with his work and his social life and his finances, to where he wasn't able to function the way that he would want to function and be be on a successful path for his life.
All right, what are the signs of substance abuse?
Probably, well, this one may sound kind of strange, but one of the signs is that somebody denies they have a substance abuse problem. Because what you'll find is if somebody's addicted to substance abuse, there'll be a lot of people around them who will make comments to them such as, "Don't you think you've had enough?" or "I'm concerned about your drinking." So if anybody has commented to a person that they've been drinking or using drugs too much, then that's an indicator that there may be a substance abuse problem. Another is lack of employment or showing up late to employment. Usually there's a lot of interpersonal relationship problems, letting people down in their family, not sleeping well. Physically, they would have things, especially with alcohol, such as you might even see liver damage, or you might see a lot of stomach upset, things like that.
All right. In general, what effect does substance abuse have on work, school-related type of activities where you have to focus?
Okay. One of the biggest effects is just showing up, because when somebody is addicted to a substance, that becomes number one in their life. Their day revolves around getting the substance. Where's it going to come from next? How much is it going to cost me? Where am I going to get the money to pay for it? Those sorts of things. And so a lot of times their day will be spent doing that and less time spent studying, going to school, or showing up for work. When they do show up for work, it interferes with a lot of the neurotransmitters in the brain. They don't function quite as well. They're just a little slower, and it just makes it harder to learn and to focus.
Alrighty. What is the most common substance abuse drug that you encounter in the age 18 to 25 or the college age?
I would have to say marijuana would probably be the biggest, mostly because in our country it's becoming more and more acceptable to use marijuana. And so most people, when you ask them about their substance abuse, you have to even mention marijuana as an option, because a lot of people don't even consider it to be a drug of abuse. And the other would be, of course, alcohol, because it's readily available for people.
All right, in your professional opinion, what type of personality is most vulnerable to substance abuse?
Well, one thing to remember is that people with family history of substance abuse problems puts them at a much greater risk for also having a substance abuse problem. There have been studies that have shown that it tends to run in families, just like diabetes does, heart disease, any type of medical illness, and it has something to do with the way the chemicals affect the brain, and so that would put somebody at risk. Also, anybody who has had, I guess, more than their share of traumatic events in their life, physical problems, people they love and pass away, and as they build and build on a person, especially people who don't do well at coping with a lot of trauma and don't really have supports in their life may turn to alcohol or drug abuse to help with that.
Okay, from a substance abuse counselor's perspective, what are your thoughts on medical marijuana?
Oh, the great marijuana question. Well, most of the people that ask me what I think about marijuana are not of legal age to use it, even if they were in a state where it is legal. I think, for one, there is an available medical marijuana even in states where it's not legal to smoke it for medical purposes. It's called Marinol, and it's in a pill form. It isn't quite as effective as the variety that you would smoke. The thing that stands out the most to me is that I would prefer that it be regulated, and for people who actually need the drug, because a lot of the marijuana that you get on the street will be laced with things you don't really know what's in it or who grew it, and those sorts of things about it. So I guess I'm kind of on the fence in general, because I have seen marijuana really tear up some people's lives.
Alrighty, how does substance abuse affect the employment environment in general within an organization?
Well, what will happen is generally low productivity when people are using. There's an increase in accidents. I know of several employers who, when you have an accident, require that you have a drug screen, and if the drug screen is positive, then they will not pay for any of the medical consequences of that. I myself, at the place where I work, have had a drug screen because they randomly do drug screens on our employees, because it can affect not only your performance, but the risks to people around you. Can you imagine a nurse who's high on drugs and then they have a needle in their hand? Do you want somebody who is abusing alcohol walking around on your roof and fixing it? It can just really impair their performance and their health risk as well as yours.
Well, more specifically, you've already answered this a little bit, but how does substance abuse in the workplace affect job performance and commitment?
Well, back to the marijuana. Marijuana has an effect called amotivational syndrome, and that is where you just lose motivation for doing things. If you think about the most common thing people expect with marijuana is to feel kind of chilled out and relaxed. Well, that doesn't really match with high performance when you're chilled and relaxed, as far as productivity especially goes. Could you repeat the question?
More specifically, how does substance abuse in the workplace affect job performance and commitment to an organization?
Okay. Well, again, when you're abusing substances, that becomes number one in your life. And so other things such as work, your coworkers, become secondary or third compared to getting high. It also can influence others around you, affect their job performance. They may be worried about you. You could have more arguments with people at work because you're irritated, because you're having withdrawals where you're trying to get the drug that you're abused to. Just lots of different interpersonal and social reasons.
In a short little summary, can you explain one or two of the most addicting drugs you encounter in this area, and how people get addicted that fast and all that goes into that?
Well, in Southwest Virginia especially, methamphetamine is probably the most addictive drug. It takes even just one time that it can trigger a part of the brain that can create an addiction. When you think about addiction in terms of methamphetamine especially, but any drug, imagine watching a black and white TV and then all of a sudden watching a 3D colored TV. That's kind of the experience people have when they're using meth or cocaine for the first time, because it hits all those dopamine receptors in the brain and just really highlights the experience that someone's having. And so you continue to use over and over to try to get that same experience, and unfortunately the brain becomes so used to the medication, or drugs in this case, that the experience never quite is the same. And so there's something called chasing the buzz and trying to get back to where you were. But methamphetamine is probably the most addictive. Alcohol is the most prevalent. More people die from alcohol abuse than all the other drugs combined. So it certainly has more impact on our society.
Alrighty, changing course a little bit. What kind of effect does Adderall and Vyvanse and Concerta and all of its different subsidies and things have on people who do not have ADHD or focusing problems?
Okay. Adderall and Ritalin especially are stimulant medications, and they do similar to any stimulant that somebody might take. 2 or 3 monster drinks, for example, anything with caffeine in it that brings up a person's awareness and their hyperness. It will increase that kind of little bit like cocaine even, because they're all of the stimulant family.
All right. How does the counseling work that you do help substance abuse, and can you give us a little bit of insight of what you do?
Okay. What I do with a client or a patient depends a lot on where they're at in terms of their awareness of their substance abuse problem. Sometimes the treatment is more about helping somebody be aware that they need to come see me. For some folks, the reason they come is because their mama told them to, or their wife said they'd leave if they didn't, and those sorts of reasons. And so the very first part of my treatment plan is to help them become aware of the consequences the alcohol or drug use has created in their life.
All right. You said that you talked about how people do not admit having a problem a lot of the times. How, from your perspective, do you get them to do that?
Well, what I use most of the time in my treatment of substance abuse is called the trans-theoretical model of change, or affectionately known as the change model. And what that means is you find where a person is in their awareness of the problem and focus your treatment efforts towards that. So if I have somebody that has no idea they have a problem, then we're going to look at the consequences maybe it's caused in their life. If there's somebody who's very aware there's a problem but don't know what to do, then we're going to talk about things that target relapse prevention, how to get rid of triggers in their life. So it's very tailored towards where somebody is in the recovery process.
Alrighty, I think that's all we have time for. Thank you for your time.
You're welcome.